I just want to trick you guys a little bit, get you guys thinking. There's some you got to intervene, there's some you got to see first, and some you have to question. SATA form. A client with TB reporting vision change after starting ethambutol. TB was buzzwords. TB, vision, and ethambutol. Put it together. Does it make sense? Yes. TB patient, they put them on ethambutol. One of the side effects of ethambutol is vision changes. This is not good. You got to let them see a doctor. That's why these people, we schedule them for ophthalmology appointment before they start developing intervention. So you got to intervene. So I need to intervene with this one. A client with bronchitis and a SAT of 92. He is COPD patient. His SAT is 92. It's not normal to me. But does he say anything? Shortness of breath. Okay. Is he in any sepsis, infection? Is he having airway issue, respiratory breathing, shortness of breath? Don't use the diagnosis as your bench line when you answer this question. Look at the whole totality. Put everything together. This, and then you have to be sharp about it after that. This is not an airway. Bronchitis, yes, I know it affects his breathing, but his SAT is 92. There's nothing in the statement that's telling me he's having breathing issue. I'm not seeing you. A client with asthma on metoprolol for hypertension. A bunch of buzzwords. Asthma, metoprolol, buzzword. You know, asthma patient is not supposed to take beta blocker. But then I'm tricking you. What kind of beta blocker they cannot take? Non-selective beta blocker, NSB. Selective beta blocker is fine. And what are the selective beta blocker? BAM, that's called BAM. Bisoprostol, atenolol, and metoprolol. This is okay. It's taking metoprolol. Don't worry about it. Just be sharp. It's not a be sharp moment. If he's taking propranolol, yes. Anything that doesn't involve a BAM, I'm not worried about it. A client with AFIB on heparin drip with a platelet of that 10,000, 100,000. Do the connection. AFIB, heparin, that's your buzzwords. You rewrite, everything is there. Therefore, heparin, if it's less than 150,000, that's a problem. This patient has a drop in heparin, that's heparin-induced thrombocytopenia. Is going to have what? Thrombosis. This thrombosis become what? A PE. And this PE is what? A breathing problem. You see how they can trick you? We're talking about heparin, but now we're talking about breathing. Yeah. Heparin decrease the platelet, 100,000 is below 150,000. Patient is going to have clots. Clots will go to the lung, have PE. PE is a B-sharp movement. Therefore, I need to intervene right away. A client with active TB on isoniazid prescribed with statin for cholesterol. Buzzwords: TB, isoniazid, and statin. Ask yourself, all TB medications affect your liver. A good statement you should remember. An individual dose medication has their specific side effect, but all of them affect the liver. If you affect the liver, it causes a little bit of cirrhosis or liver function will increase. Statin is another medication affect the liver. So you can't have two. You're causing too much injury to the liver. I need to intervene. A client with clots in the foley bag 4 days after TURP. So after transurethral prostatectomy, 3 days, they can up to 3 days, they can have clot in it. If there's clot after 3 days, that means they're bleeding. This clot is what? Bleeding. This bleeding is what? Shock. This shock is a B-sharp moment. Therefore, intervene, see first, do something about it.